A sudden loss of taste and smell is a common symptom of COVID-19, but a less common symptom is a distorted taste and smell.
It's called parosmia, and an increasing number of people are struggling with the condition long after recovering from the virus. Fox's Haley Rush explains how this is affecting patients.
When I say distorted, it often means a rancid, horrible smell and taste. Many people with parosmia say foods they used to love now remind them of chemicals, garbage, even dirty diapers, and it's affecting their lives mentally and physically.
Everywhere Joyce Moore goes, it goes too.
When I'm talking to somebody, I keep thinking, can they see this cloud of yellow smoke coming out? I just feel like I must have intense bad breath because I smell it and I taste it.
In late August 2021, Moore battled COVID.
I ate during that time. It didn't affect my stomach or anything. And then afterwards, I just realized I couldn't smell anything.
Over time, that lack of smell turned into a distorted one.
Right now, what I'm experiencing the worst is a real offensive, chemical, rancid smell and taste. There have been times when certain foods were just offensive and horrible.
Let's say you're brewing coffee, and we all know what that brewing coffee smells like. But to the patient with parosmia, they actually might smell cigarette smoke, or I guess some smell that is not desirable. It's typically an undesirable smell, parosmia.
Dr. Timothy Smith is a professor of otolaryngology, head and neck surgery, and the director of the Organ Sinus Center at OHSU. He says it's loss of smell that usually affects COVID patients, and that then influences how they perceive taste. He says about 80% of people who lose their sense of smell with the virus will have regained it within 3 months.
That still leaves 20% who've not recovered their sense of smell. And that's a large proportion and much larger than other viruses that we've had experience with.
And that 20% includes some people with parosmia.
There's a lot of research being done, and there's still probably more that's unknown than is known.
But he says there are a few things doctors know. He says when a patient loses smell or experiences an altered one for a long period of time, the virus goes beyond just causing congestion and actually damages nerves inside the nose.
It's clear that when these nerves are injured significantly, it takes them weeks, months, and even years to recover.
And years to recover is something Moore hopes isn't her story.
Eating is more of a chore than a pleasure.
Coming up tonight, we'll hear from others suffering with parosmia. We'll also talk more with Dr. Smith and learn what kinds of treatments can help these patients. Haley Rush, Fox 12 Oregon.